Hey class, in this recording we're going to focus on volume changes of the heart. So as we're looking at the heart, typically in an ideal situation, the right side and the left side of the heart are going to always be ejecting the same amount of blood, the same volume of blood, even though it's very different pressures when we look at the right ventricle compared to the left ventricle. And whenever we have an imbalance between left and right ventricular output, a lot of times that typically is going to lead to CHF, congestive heart failure. And when we look at this term congestive, it's like when your nose is congested and the fluid, like you have improper flow of the air in and out of your sinuses. If you have congestive heart failure, you have improper flow of the blood out of the ventricles. And a lot of times congestive heart failure is going to happen because there's some kind of weakness of the muscle. There can be some kind of an infarction. There can be chronic hypertension, so chronic high blood pressure can cause that heart to be weakened or malfunction. There could be some kind of defect in a valve, or there can be a congenital defect, something that is structurally wrong with the heart. So let's talk about balanced input and output. So right here, if we have output from the right ventricle exceeding the left ventricle, we're going to have more liquid being pumped to the lungs compared to being pumped to the rest of the body. And if more liquid is going into the lungs than is leaving the lungs, the difference between the two is going to equal the liquid that's left behind in the lungs. So if we have right ventricular heart failure, we are going to have pulmonary edema, liquid building up in the lungs. And on the other hand, if the left ventricular output exceeds the right ventricular output, more liquid is going to the systemic circuit than is leaving the systemic circuit. And that leads to systemic edema, or edema of the body tissues. Now, as we look at the amount of blood that leaves the heart, that is referred to as cardiac output, or CO. And it's going to be the amount of blood ejected by each ventricle over the course of 1 minute. So to calculate cardiac output, and yes, this is some nice math right here, you need to take the heart rate and multiply it by stroke volume. Heart rate's typically going to be in beats per minute, and then stroke volume is going to be milliliters per beat. And yes, I am going to expect you to be able to do this on your lecture exam. No, you do not get a calculator. I'm going to give you nice happy math numbers, single and double digit math. Very, very easy math that a fourth grader could do in their head. Now, as we're looking at this kind of cardiac output, for a typical adult, it's going to be 4 to 6 liters at rest, or 1 to 1.5 gallons per minute at rest. And that red blood cell that leaves the left ventricle typically gets back to the left ventricle in about 1 minute. That's about how long it takes an individual blood cell to go through the entire systemic circuit. Now, if we're exercising hard, that can increase cardiac output to 21 liters per minute. And if we're talking about somebody who's a world-class athlete, up to 35 liters per minute. So those world-class athletes can really pump blood quickly. As we look at an individual's cardiac reserve, our cardiac reserve is going to be defined as the difference between their resting cardiac output and maximum cardiac output. So those world-class athletes that can pump out 35 milliliters per minute when they're trying hard, but only pump out 4 to 6 liters per minute when they're resting, they would have a cardiac reserve of about 30 liters per minute. So you can increase your cardiac reserve by exercising more and avoiding preventable diseases. As we look at our heart rate is going to have just the beats or compressions of the left ventricle, and they can be referred to as a pulse. This pulse that we feel traveling through our arteries is a surge in blood pressure that can be palpated or felt for a medical purpose. These pulses are typically referred to as just a beat or a heart rate. When we look at infants, they typically have a high heart rate. 120 beats per minute is pretty normal. And as we look across mammals as a whole, generally speaking, the larger the mammal, the slower the heart rate. Young adult females have a heart rate of about 70 to 80 beats per minute, whereas young adult males have a heart rate of about 65 to 70 beats per minute. And the heart rate is going to rise again when we become elderly, and this is typically because of congenital or age-related defects building up and making the heart have to work harder. As we look at elevated heart rates, the technical term for an elevated heart rate above 100 beats per minute is tachycardia. And some things tachycardia in and of itself is not a bad thing. If you're stressed out, if you have some kind of anxiety or fever, those can all induce tachycardia. Or there can be some other issues at play, like drugs or heart disease. Some other things that can cause tachycardia include loss of blood. And if we lose blood, if we lose a significant amount of blood volume, our blood pressure starts to plummet. And to compensate for lowering our blood pressure lowering, our heart will increase its heart rate and cardiac output to help elevate our blood pressure. If we have damage to the myocardium, or the muscle of the heart cannot pump as effectively and consequently needs to increase its pumping rate to compensate for the lower stroke volumes. Bradycardia is when there's a resting heart rate of less than 60 beats per minute. Generally speaking, most of us will have bradycardia when we're sleeping or if we have just a decreased body temperature. A lot of times lowering our body temperature goes hand in hand with sleeping, or if we are endurance trained athletes, a lot of times we'll have bradycardia. And as we're looking at chemicals that influence heart rate, they are chronotropic chemicals. When we think of chrono, think of time. So if we have a chemical that influences the amount of time between beats, it's a chronotropic chemical. Positive chronotropic chemicals are going to raise our heart rate. Negative chronotropic chemicals are going to lower our heart rate. So as we, did I go too far here? Yep. Let's stop on this page here. So, guys, gals, if you have any questions, please feel free to shoot me an email or post them on the class discussion boards. And as always, happy studies.